I'm Dr. Rosenhan, and the year is 1937, and I'm going to begin my study of being sane in insane places. Now, what fueled my study is I'm very interested in how we define sane and insane, and what is being abnormal. So the aim of my study is to see whether 8 sane people, when put into 12 different hospitals around 5 different states in the USA, will be deemed insane by professional psychiatrists.
What seems to be the problem?
I keep hearing voices.
What do they sound like?
Like empty and hollow.
Very interesting.
It's very scary.
Good morning.
Hi.
What seems to be the problem?
I've been hearing voices.
Voices, you say? What kind of voices?
Kind of like a thud in the back of my head.
A thud? Ooh, that doesn't sound good. I think we're going to have to admit you.
So 8 different participants went to their doctors and described the same symptoms as the ones you've just seen. All 8 participants were admitted. I was one of the participants. They were all successfully admitted into psychiatric hospitals. Now from there, each participant was told to act completely normal during their time in the wards, and when they were given medication they were told not to take it. So here I am with one of my participants from the study. So did anyone doubt that you were insane for any period of time while you were in there? Oh wow. And how long would you say you were in there roughly? How many days were you in there for?
19 days?
That's a very long time. Did any of the staff ever ask you any more questions, any more testing done on you at all?
No.
Okay, thank you. So, how long were you in the hospital for?
It was about 54 days.
And did anyone ever doubt you, or did you feel like your behaviour was changing at all while you were in the hospital?
Well, how can't it? You're in a mental hospital.
Did any of the other patients ever think that you might be sane?
Sane? A few, but not really. No one really picked up on it like hugely.
What are you doing? My hospital didn't do any of those things you're telling about in your experiment.
Well, Doctor, you're from the Learning Hospital, aren't you? Well, we will test my study once again. Over the next 3 months, I'm going to send in at least 1 sane person to be admitted into your hospital. I want all of your staff to rank from 1 to 10, every patient they admit, how likely it is that they are the same patient, and we'll see how accurate your diagnosis is.
Fine.
So, out of 193 patients that you've admitted over the last 3 months, how many sane patients did we send you?
Well, we documented about 41.
That is incorrect. We did not send you any sane patients. So, the strengths of my study were that I varied the hospitals, so my results are generalisable. And my design was very simple, so the patients just had to be themselves, so there's no validity issues here with them pretending to be themselves, and that's what got the results. It was all a natural study. And by only using 8 patients in 12 hospitals, my study is very easily replicable, which increases the reliability. My findings are strong and strongly applicable to today's society as well. My participants did lie to the doctors in the study, saying that they heard voices, which is a very typical symptom of schizophrenia. This may have guided the results to be unnatural and less valid. And the study is 40 years old, so it's hard to apply it to today's society, so maybe diagnosis has changed and it's not actually useful today.